So basically you're saying, apart from what you are doing and people like Dr. Venage in South Australia, these people who can't get a job have no one taking up their cause.
And Ellen, these people are what you and I would call conservatives.
Yes.
Right? These are people that had the courage and strength and believed in their own, individual rights to stand and say, well, I'm not going to have this. This is wrong. Now, these are the people that traditionally vote LNP. These are the people who are the LNP constituency. All the LNP's got to do is say, hey, guys, we've made a mistake. We now support you and start yelling and screaming.
Yes.
And once that happens,
I agree.
Labor would collapse.
I agree. That's why I'm talking to you. I interviewed a young lady born in Cambodia. She arrived here via a dangerous open sea voyage from Vietnam. She finished up in a refugee camp. She came here as a 12-year-old and began her education. She finished up graduating from medicine at the University of Sydney. She was suspended from her medical practice because she prescribed ivermectin to treat a gravely ill patient with coronavirus. The patient recovered quite speedily. She is banned from practicing. Now, Graeme, where can such people turn to? This is 12, 15, 18 months on.
Well, I guess we're basically it. You're talking about it. She was a nurse or a doctor?
No, a doctor. A doctor.
Yeah. Well, we 2 years ago or 18 months, we set up AMPS, which is Australian Medical Professional Society. And we are that particular group under Cara Thomas, and who's the secretary, doing a fabulous job. We are we're looking like getting a case up against APRA. We're just sort of sorting that out now.
This is just people watching you tonight just can't believe this. That's why I've done this again. I've spoken so many times on this program. I spoke, Graeme, recently to a former employee of New South Wales Ambulance, a paramedic, terrific and distinguished career, can't get a job anywhere because he's not vaccinated. His wife is a registered nurse with a postgraduate diploma in acute care, a master's degree in clinical teaching, husband and wife, 6 children, can't get a job. Who the hell is coming to their aid?
Well, we can only do so much, but it's essentially a political question.
It is.
And the LNP have got to wake up and say, excuse me, this is our constituency. Things have changed. These people need to be brought back to work. Definitely. But they won't do it.
Definitely. They were protesting. These people unemployed were protesting because they didn't believe that vaccination would stop transmission. That's what they were told. I don't want to know about it, they said, which is their personal entitlement. And they have now been discriminated and continue to be discriminated against in a democratic society. Dr. Asim Malhotra is a British cardiologist. Recently in Australia, he argued that these vaccines should not have been given to anyone. Now, many of these people work in essential services.
We bought him out, Ellen. We bought him out.
Yes.
The Red Union bought him out. Abs. Yeah, so sorry.
No, but the bloke in Struggle Street is discriminated against, but he can't afford to defend himself. And so where are the opposition? I don't know. I honestly do not know what can be done for these people, but it's a disgraceful treatment of decent Australians.